Hey, good evening, everyone. I'm back again for what I said I was going to discuss this time, which was basically what's been being spent in our government and worries that my one of my good friends has about health care, what will happen with health care. She has a son on SSI. He's has some mental health issues, and she's worried about what will happen to his disability status and his meds and everything, which is totally understandable. And I feel for her, and I can't say exactly what's going to happen. What obviously we want the best for these people who have disabilities. I don't think they're just going to go away because DOGE, the Department of Government Efficiency, was going to come in and clean up things. I don't think that's one of the things they're just going to wipe out. It just wouldn't make any sense. There's so many people that need that help. Something I wanted to share was the 18 hours ago, DOGE posted that in the fiscal year 2023, the U.S. government spent $6.16 trillion while only bringing in $4.47 trillion. The last budget surplus was in 2001. That's a long time ago. This trend must be reversed, and we must balance the budget. Yes, it's been out of control for a while, but I didn't realize it had been that long. That's over 20 years. So what they say after that is their most recent, 18 hours ago, their most recent approved grants. The U.S. government recently approved the following grants. $45 million for a diversity and inclusion scholarship in Burma. $3 million for girl-centered climate action, in quotes, in Brazil. $288,563 for diverse bird watcher groups. And again, this is all wasteful spending, as we know. So at least they're keeping track on that, which is what they're supposed to be doing. I like to see that they've already started this before they get into office, and that way they can hit the ground running when they get in, so that they can fix all these issues. There's another one in there that they talked about buildings. Federal government agencies are using, on average, just 12% of the space in their D.C. headquarters. The Department of Agriculture, with space for more than 7,400 people, averaged 456 workers each day. That's 6% occupancy. Why are American taxpayer dollars being spent to maintain empty spaces? Again, that's another important thing they'll need to tackle. But, there's a lot of money there that can come back to us. And that's where and that may be where you're hearing, that's probably where we're getting that's part of it. The expressions, we're going to hit another golden age. President Trump has said that. Laura Trump has said that. Somebody else just said that. I can't think of who it was. With all of us hurting and having all these issues, my health care, I don't have any health care. I work part-time. I can't really do full-time in this job at the restaurant. It's too taxing on me. But I have partial dental and vision, at least. But, I'm in that abyss between not poor enough to get Medicaid and not rich enough. I don't know, rich enough, but I'm not middle class. So I'm stuck in this abyss where I don't really qualify for Medicaid and all that. So I had to get some other insurance through private company. And I used to think, years ago, everybody should have health care. And I do think everybody should have health care. Affordable health care. That doesn't bankrupt people, if they get ill. But then, and I also was okay with the UBI at first. I liked Andrew Yang's UBI idea, using the way he had it was something to do with the wealthy people that they took some percentage off their dividends or something. I can't remember. But once COVID hit and all of that controlling happened, the mandates, the lockdowns, all these forced things, and then when we saw what happened with the Canadian truckers protest, yes, we're not in Canada, but that doesn't mean it can't happen here. People who were just supporting, just giving money to the protesters, their bank accounts were frozen. So I worry now, and I'm not really for doing it through the government now because of how they can, if you do that social credit deal, they can just close your account or freeze it and not allow you to use something if they don't like what you're using it for. And so it's kind of a conundrum because I want everybody to have a Medicare or a TRICARE type of system. I think everybody deserves. I think it is a human right. That your health is a human right. You should have coverage. It's just the way to go about doing it. And so perhaps if we end up in a golden age and we end up with so much more money in our pockets and so much a better way to live and more healthy, and we have the means to get affordable health care, the health care prices will go down, the prescriptions, the appointments, the primary care, the emergencies, the hospital stays, all of this is held accountable, and then at that point, maybe then we can afford, everybody can have insurance and health insurance. And another thing I never understood is why your teeth for dental and your eyes are separate from healthcare, because they're all part of the body. So does that make sense to you? I don't think it makes sense to me. I do remember when Bernie Sanders was going on about, healthcare for all, and he said, and we need to get hearing aids for the elderly as part of Medicare. And I was just surprised. I was like, what? You don't have that as part of it? It wasn't part of the Medicare deal where, you need these things. You need you need glasses. You need hearing aids when you're older. And I just thought that was such a huge oversight. That is all part of your body. All of that should be included in health care. I really believe that. I think anything that's having to do with your body should be part of health care. And that, just like mental health is part of the body. And so that's my thoughts on it. Do you all want health care for all? And do you have health insurance? And how do you feel about it? When I was first looking at health insurance a couple of years ago and I was trying to go through all the plans, I felt like it was somewhat of a scam because, you have this premium, there's a lot of, thousands of dollars in premium, out of pocket that you have to pay just to get covered. And it, unless you're chronically ill, you're not going to go through that in a year's time. And I certainly would rather be healthy than chronically ill. So, but the point is that's very expensive. There were some that had copays and deductibles, but the copays didn't go towards the deductibles. So you're still paying all that plus a monthly amount you have to pay for your insurance. And I thought, well, that sounds like a scam. That's just crazy. There are 3 different ways of having to pay. But I did find one. I found one that was decent, and the copay does go towards the deductible. An agent helped me through it, and it starts in January, and we'll see how it goes for that year. I have to think about that kind of stuff at my age. The healthcare is needed. So I hope things are reformed, because if DOGE does all this and takes out all that wasteful spending, closes down unnecessary departments, stops all the money overseas, no more wars, I really do see how we could have lots and lots of money back here to work on our roads, to work on an actual high speed rail system, which would be awesome. And I think Elon Musk would be up to that. I think he'd be interested in that because he really likes those kind of innovative ideas and creations. We'll see. But that's where I am at. I don't know how you are about all this. You can leave comments below. And thanks for watching. If you like my channel, please follow it and like my videos. Until next time, have a blessed evening.